Hi, it is the 25th of March and I thought I would check in and just kind of give a little bit of an update about what I've been doing. So I had a bit of annual leave towards the start of March and then I went on Umrah. So it's been a really exciting, busy time so far. I thought I would do a little video just to capture kind of the end of cardiology because I'm approaching the end of this rotation, which is going to be really exciting, and then I'm moving on to ENT. So I thought I would record my little reflections from just darker compared to before. So yeah, everything's changed. I feel like everything's changed. I've done 2 on-calls since I've been back, so they were good. It was like there's a lot in any field wherever you go, there's always going to be competition, and wherever you go, because we were talking about the experiences that another one of the consultant surgeons had in his training where he found it difficult to kind of maneuver certain situations and in terms of like reach his capabilities and the best capabilities he had.
I have no tripod. I'm hoping. Okay, it fell. Oh my god.
Ready for a 12-hour shift.
Okay. All right. We are going for a 12.5-hour on-call shift in cardiology. So it starts off with a ward day, starts off with a ward round, starts off with getting to know all the patients, going around the wards to see the different patients, to take a history or clock any new patients that may have come in. There's a really interesting patient that I already saw on the weekend that I'm just going to follow up with, and then the afternoon is spent kind of carrying out that plan. But because it's a on-call shift until 9:30 p.m, I'm going to be handling tasks from different wards as well, so it's going to be similar to the way that I had the weekend on-call shifts in the past. Hopefully not chest pain. But yeah, I'm fasting. Let's see how it goes. Hopefully it's fine. But I've heard from working while fasting is hard, and I'm already sleepy even though I had that tea at Sehri time. So let's see how it goes. I'm nervous, but I am still energetic at this moment in time. Let's see how it goes.
Although, to be fair, there are 2 answers here. No, there's still going to be one.
In the hospital, let's go to the ward.
So it's 12 o'clock, we just finished a ward round and we saw patients with cardiomyopathy, we saw patients with chest pain out of hospital with a viral flu-like illness, so we're suspecting myocarditis. We're checking for the ECG for patients with fast AF or who are tachycardic. We're adjusting doses of bisoprolol medications, heart failure medications, we're checking all of these things. And that takes about like an hour and a half to 2 hours with some patients, especially when you're clerking new patients into the ward and you're making sure that they're on their heart failure tablets, their heart failure drugs. A lot of patients who are with heart failure, and we're just managing diuresing them with IV diuretics. So you can give them continuous infusions of 160 milligrams or 240 milligrams of IV diuresis, and then it's a matter of what's their fluid input, what's their fluid output, are they fluid restricted, checking their weight loss day to day and staying on top of their weight loss. There are some patients who are not going to be kind of improving clinically, so we have to make sure that they're on the palliative medications and they have a DNA CPR form in place, a respect that are kind of pending for on-call doctors to go see them. So there's things like blood levels, INR levels for warfarin dosing. Then there's also chest x-rays that have been reported now that are coming back with the results, so we have to kind of assess those, and patients who are scoring.
This morning, and I was just like
Finding it really hard to get out of bed, even though it's only day 2, but it's day 5 if you count my weekend on calls as well. Even my voice sounds tired. Oh my god, it's just okay. So I'm wearing black scrubs today because it's potentially our last day on the ward. So we might take pictures and as an end of it. In the end, it was busy. Ignore my kitchen, that's a mess. I think there's just always going to be a mess. We just have to accept that. It's fine.
So I was all ready to work on my ward. CCU, which is coronary care unit, and it's where all of the admissions, the STEMIs, the NSTEMIs, the ones who require monitored beds, and the ones who are kind of more serious go. So
No, you're eating.
I'll be eating.
Oh, that's nice. Positive feedback. It's been so nice working together, hasn't it? With all
I
the
work on the opposite to those. Did you show me stuff?
what? With all the high EWS patients all by herself.
Okay.
She only needs to escalate to the registrar occasionally. And then all the registers love her.
I've actually not been this tired before.
How do you feel on our last ever on-call together? After
It's not our last. We should not do this again together. This way.
she likes to dream about cardiology on-calls.